are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Everett.
Hello, everybody, and welcome back to another episode of Extracting Wisdom. I am your host, Brandon Everett, and joining me on this episode, and this is actually like the second episode I think I've recorded since Voices of Dentistry, so I'm a little rusty at this, but
oh man,
joining me is no stranger to Extracting Wisdom. It is the one and only Tyler Tolbert. Welcome back, buddy.
Hey man, it's good to be back. I am super impressed that this is only the second one you've recorded since VOD. I think I've probably done about 15, 20 episodes since then. VOD dried up for us really quick. So I'm very practiced in coming on here. So welcome back.
Hey, thank you. Yes. Well, you guys release a lot more often than I do too, actually. So yeah,
yes,
I think it all evened out.
Yeah, it did. Yeah, I'm kind of back to where doing a recording every week is just kind of keeping the ball rolling. It's not really getting me ahead of anything. So
yeah,
I'm kind of spinning my wheels, but being in quarantine and everything, it worked out nicely. Recorded a lot of good stuff. And yeah, it's good to be back here for my like fourth or fifth time. I don't even know anymore.
Yeah, I'll have to go back and look. I think it's probably your fourth or fifth time. I think you're definitely the leader.
I'm a vet.
In guest appearances on the Extracting Wisdom podcast.
Well, I'm proud of it, man.
Yeah, absolutely.
You got a great show here for sure.
Well, thank you. And I think we're going to have a great episode tonight, a great discussion. So this past Wednesday, I just entered patient care for the first time. And so I really just want to take tonight to just kind of pick your brain and kind of hear from you, like what entering patient care was like.
Yeah, well, I kind of want to hear your experience first, and then we'll see how well I relate.
Okay.
Because this is fresh for you,
It is. It's very fresh.
Yeah.
I mean, in fact, like my head is spinning. It's been, I have so many like a million things going on. I still have exams on Friday and Monday, so it's like trying to juggle all these different things. But basically, last week, Monday and Tuesday, we had a virtual clinic orientation. So they just took us through like how to use Axiom, and you guys use Axiom, right?
Yeah. Okay. I think it's pretty universal.
Yeah. So they took us through all of that and just the basics, but I think doing it in a virtual format is a lot harder to like learn and retain all of that because you're like,
for sure.
You're just sitting there on your phone, just, doing whatever as they talk, and it's difficult and it's hard to learn that and not actually do it.
Yeah. And it's not exactly the most user friendly system either. So
yeah. But the good thing is, being in the COVID era of things right now, our clinics can only operate at half capacity. So because of that, we actually have to pair up with a D4, which is kind of nice. I actually really like that because
that's cool.
I have somebody to pick their brain and help me with Axiom and just learn how to schedule patients right off the bat. So I think at least starting clinic, I think that's a really, really good thing.
Yeah, no, I agree. And they're kind of with you throughout the procedure as well.
Yes. Yeah. So
that's great.
Right. And so we each have our own patient pool though. So how it works is that like, we each call and schedule our own sets of patients, and whoever's patient it is, typically that person will be the dentist and then the other person will be the assistant. Sure. So that's pretty much how it's been working. But for pretty much here at UIC, like they literally just dumped, I think I have like 35, 40 patients already that I have to, I know. And I don't know.
Wow.
I think it varies from student to student, and we have 4 or 5 independent like clinics. So it depends on how busy each clinic is and where you're at. But, reading through patient charts now and like trying to figure out where everybody is within treatment and like trying to read through past notes and like that, it's so confusing at first.
Yeah. That doesn't change a whole lot. I mean, your ability to process things will definitely get better. Your mind will just sort of work and be able to, make this sort of mental inventory of all kinds of little details. And the longer you do it, the easier it is. It's just kind of like, if you ask LeBron what happened on this play back in 2011, he can like recount it perfectly. And he's a genius. But at the same time, I mean, that's just kind of how our brains work. As you kind of keep on practicing this and you do it day in and day out, it gets a lot simpler. And it's just a huge jump, going from talking about theoretically working with a patient to actually trying to work through a patient and figure out, what comes next.
Right.
It's bewildering. And I did not start off with 35, 40 patients. I've like very recently gotten somewhere in that neighborhood. So I can only imagine how wild that is for you.
Yeah, it's a little overwhelming. I mean, it's kind of nice. I've been just breaking it down day by day. I haven't like called every single patient yet. I'm trying to stagger it out and call, 3 or 4 a day just to try to make sure I don't have all 30 patients or whatever trying to call me back the very next day, because that would make things really hectic. So
that's a lot.
Yeah, it is. And I mean, it's mostly recall and, either perio maintenance or just regular like POEs or prophies, whatever. But in the COVID era of things, like that's going to be even more difficult because now it's all hand scaling. Like we can't even use Cavitrons or anything. So it's going to be an interesting summer for sure.
So hold on, let me see then. Are you going to be using a handpiece?
So UIC has 3 phases, like 3 phases to get back into like normal clinical care. So phase 1, which is what we're under right now, is basically zero aerosol production, or is very like to a minimum. So we can only do like just basic exams, basic cleanings. There's really nothing else other than that. Phase 2, which is coming July 17th, very soon, is we can actually go and start placing direct restorations again, as long as you're using like an isodry or like high speed suction, obviously something like that, just to decrease the amount of spray that's going on.
And you also have an assistant that's
correct. Yes.
Holding high volume. Okay.
Yes. Which is going to be very helpful.
Right.
And then phase 3, which will be like crown preps. So like phase 2 includes like basic endo and like direct restorations, like I said, but then crown and bridge type work is this phase 3, which is to be determined. We don't really know yet when we can do it, but we're getting there. Like hopefully, I guess a little over a week, we'll be back to maybe somewhat normal.
Wow.
Or at least it'll feel that way.
That's impressive. That's a very expedited timeline. Gosh, I gotta say, I envy you once again. I have so many reasons to do that, but this is a whole new one. We're going to be kind of lucky to be seeing patients in August, I think.
So are you not in clinics at all right now?
I'm in the clinic.
Well,
physically.
but seeing live patients.
I have one patient. He never cancels on me. I can always get him numb, and his tongue never gets in the way because frankly
he doesn't have one. Yeah,
that's right. Yeah. So, I work on a mannequin day in and day out.
Wow.
And, this is the start of my D4 year. I mean, typically I'd be off on rotations and, coming to senior clinic and, seeing a couple patients a day and, just chugging along. But so I've been, kind of twiddling my fingers a good bit.
Right. So that's interesting. How is that? Are you just like showing up and doing whatever procedures that you want to do on it? Or do you have like set things that your faculty wants you to do, or how does that work?
Yes.
Yes. And
it's
yes.
it's like I have, things to do. And then once I get done with those, I can kind of freestyle a little bit.
Okay.
It's all a pretty laid back environment. We're assisting each other, surprisingly enough, despite the fact that we're working on plastic teeth.
Okay.
But I guess that's to kind of acculturate us into working together as assistants, because that's kind of how it's going to be going for the foreseeable future, which I actually think is a good thing. I don't know that it's necessary for us to be practicing it while working on mannequins, but I'll let that be. Got to pick your battles, but so I mean that's all we're doing. We just kind of go in and they're kind of trying to challenge us a little bit with what we're told to do in a given morning. Like today, it was an FPD prep temp and impress within like that morning appointment.
Right.
And personally, I try to do whatever it is in half the time. So I'm like, really trying to work on my speed. So, I mean, I wouldn't say that I'm not making any progress. It's just definitely not what I had hoped for.
Right.
But there are certain factors you can control and others you can't. And you just kind of keep on rolling the best you can.
Right.
I mean, if this keeps on going too long, I might need to transfer over to UIC and,
come on down, man.
Maybe we can be working together. I can be your D4.
That would be the dream team right there.
Oh man, what an episode that would make.
Yeah, a live episode with Brandon and Tyler as we treat patients.
Oh man, that'd be a mess. That'd be good. But yeah, I'm adjusting to the way it is and trying to stay busy outside of school and come on here and do podcasts pretty often. That's kind of, the reason I'm getting out of bed in the morning. So
yeah.
But yeah, tell me more. So you have seen a patient.
So yes, right? Actually. So
okay.
I haven't seen any of my own patients yet because I had to call them and schedule them. I think next week is when I start seeing my own patients. Mm-hmm. But funny enough, my partner had patients, so I was assisting him. And the first 2 days we were in oral surgery. It was like right off the bat, we were getting some good action. Like I think we extracted 11 teeth in 2 days. And I got to do, a bilateral, a block, which was pretty fun on the mandible. So get my hands wet, get my hands a little bloody, which is fun.
Did you miss the block or did you nail it the first time?
Got both of them on the first time.
Oh God.
I think that was definitely luck though. That was definitely luck.
No, there's no luck to it. I will say though, I was like really fortunate early on with my blocks. Like I wasn't missing a block even in like stab lab and like the first few months of clinic. And I was like, man, I'm just a natural, I guess. And then all of a sudden it was weird. I just started missing them. I mean, like half the time.
Really?
Yeah. And I had to like really kind of go back into my anatomy and like get a hold of some models, like some dentiforms and stuff, and like just practice it and watch YouTube videos. It was weird. Like I was a natural, and then I thought too much about it, and then I got bad at it. And then just have slowly been trying to work myself back to where I was right there at the beginning of D3, just nailing every block. So I hope that it's not just the honeymoon phase for you. And
fingers crossed. Hopefully,
keep up. I mean, you're batting 100. I wouldn't want to.
Very limited at bats, though.
Yeah. Well, that's why you got to stop now.
Right. Yeah, I'm done.
Yeah. You've had a good career, buddy.
Yep. That's it.
But that's awesome, man. I'm happy for you that you're getting that kind of clinical exposure. It's such a weird time.
I know it is
to be in dental school.
It really is. Yeah. It really is. But I'm glad. As of right now, our faculty has planned it where we'll still graduate on time. But our school is open from 8:30 to 5:30, and then 3 days a week. It's also then extended to like 7:30 or 8 o'clock. So we could potentially be in clinic for a good 12 hours a day, potentially. But,
at this point, that doesn't sound that bad.
I mean, it's better than drilling on Dexter over there, isn't it?
I know. Yeah, that's tough, when you're just thinking about, because like I'm at the point where I'm not really concerned about the requirements and like getting stuff done to get out of school. Like I'm not really thinking about that anymore. It's more just, I want the experiences, I want to get the reps in, and we're not getting that. So it's tough. Just trying to double down on my continuing education and doing things outside of dental school the best I can. So, but I keep making this about me. So
no. I want to hear like what kind of CE are you doing or planning to do?
Well, I have one coming up next week. I'm actually going with Peyton Keller.
Oh yeah, he was actually the last episode I released was with Peyton Keller.
Is that right?
Just last week. Yep.
I'm gonna have to look that one up and see how he did.
He did great.
Good. I'm sure he did. But I'm still gonna have to grill him. But yeah, so we were in on a group call, and I don't know, somehow like ortho had come up, and he mentioned that he's like actually kind of interested in doing ortho in his practice one day. He wants to be a GP, and wanted to like get more familiar with how ortho can be done in the private practice structure. And I just happened to be on Facebook earlier that day and saw that Baron Gruder out in Kansas City was putting on a digital ortho course. So he does all his stuff in house, does the full mouth scans and then plans everything in Blue Sky, and actually prints out aligners and, phases all that treatment for his patients. And he actually does like some stuff that kind of goes beyond just your typical like Invisalign type cases, your typical clear aligner cases. So so we're heading out there, and we got a good friend, Clay Schwenke, out there as well.
Oh yeah. Another previous guest.
Yes. That's right. That's right. I almost forgot. So we'll all be kind of hanging out in Kansas City and having a good old time. And that's been great. And then, that's actually the first, off-site CE I've done since VOD because of everything. Yeah. And so I'm really excited to be making that trip. But a lot of this has just been like online CE. Yeah, a lot of it. I joined RIPE. It's Restoring Implant Practice Excellence.
Okay.
Which makes it sound like it's all about implants, but actually it's like an online membership, like $30 a month, and they're always posting tutorial videos and walkthroughs and stuff.
Oh, that's cool.
Yeah, it's great. And so I've been going through that, a bunch of like the Blue Sky stuff on YouTube that's free, and reading some books and listening to podcasts and stuff, just trying to live vicariously through other dentists pretty much.
Exactly. Yeah.
Yep. So it is what it is. But yeah. So you have not seen your own patient, but you have seen a patient and you've gotten your hands dirty. I think that's fantastic. I'd like to congratulate you.
Thank you.
Because it's an amazing time when you're able to actually, kind of see the rubber hit the road and see what you're made of. And, I don't know how it was for you, but for me, when I first started seeing patients, it was like, yeah, this is what it's all about. Like,
that's right. I was so excited. The only thing is I was slightly dizzy because I was,
oh, really?
Well, it was because of my N95 mask was choking me because I had 4 masks on, 2 face shields, but it's so much PPE. And I mean, I get it, obviously we have to have it, but, man, it's a lot, especially if you're standing and suctioning and like bending every which way to try to, accommodate your provider.
Yeah. And you're like crazy. Going on a spacewalk pretty much. You just, you got all this stuff on. I really hope some of that stuff doesn't stick. I don't know at what point we're able to kind of move down the measures and go back down the ladder of PPE, but boy, I can't wait because I sweat.
Oh yeah.
I sweat normally,
right.
Without all the layers. So yeah, that's going to be a mess. Fortunately, I haven't really had to don all that stuff yet because I obviously haven't been treating patients. But I know the time is coming, and I usually operate with a fan in my operatory. Like I have like a little stand-up fan, and I'm experimenting with turning it off just so I can be prepared for just the sweltering heat and shortness of breath that I'm going to be experiencing. Not looking forward to that, but
it is what it is.
At least I'll take whatever experiences I can get.
Exactly. Yeah. Okay. So a couple things I want to pick your brain about now about treating patients.
Of course.
Do you guys, I know some schools do it differently, but do you have to call all your own patients and schedule them? Okay. Yeah. So what are some tips, advice, funny stories, whatever you want to tell? Like what do you have on that topic?
Oh boy. Okay.
I know I'm putting you on the spot, but
yeah, sure. Well, to start, just on like kind of a personal note, I have this really weird anxiety about talking to people on the phone. I don't know what it is. I don't mind going on podcasts. I don't mind talking to anybody in person. No problem. But there's just something about like removing the visual element of communication that just like really bothers me. And I'm like super self-conscious about how I sound, my word choice and everything. And, like I remember when we were first supposed to introduce ourselves to our patients, and I had like 5 patients at the time that I needed to call. And man, I put that off. Like everything else that was on my to-do list got done. No problem, because I was going to do, whatever it was way more urgent than me calling my patients to let them know who I am.
Right.
And so, that was like really hard for me. But obviously you have to do it. You just press the button and then go.
Right.
But it's always better, like once you actually get to talking to them and introduce yourself to them, because you're not cold calling. They're expecting your call. They're waiting for you to call because they have some sort of concern.
Right.
And I worked on my calls a lot. Like I have scripts.
Me too.
On my computer. Yeah, exactly. And like, I try to know everything I can about them beforehand. And I mince my words very carefully when I'm talking to them. It's gotten more natural and I don't sound so robotic anymore, but yeah, at first it was just like, it was like a play, like I was just like so worried about how I'd be perceived. But I think, to give a pearl, I suppose, one of the most overused terms in dentistry, but, to give a pearl, I think it's, you have to figure out why they've come to you. I mean, it seems obvious, but figuring out why they are coming to the school, what is it that they're concerned about, and try and dig a little bit deeper to figure out what it's really for. Mm-hmm. I find, at least in our population, that a lot of the people that are coming to the school have not really had the most consistent history of going to the dentist.
Right.
And there's a reason that they're coming to a school. Mm-hmm. And it's not always as simple as, oh, it's just the cheaper option or whatever. I mean, yeah, that's very likely true, but there's a reason they're coming to you now. There's a reason whatever their problems are enough now that they're willing to come into a clinic and sit down for several hours to, have an amateur dentist practice on them,
Yeah.
And so it's about finding, what it is in their life that they're looking to change, what it is that they're trying to improve, and always being able to relate back to that. And that really just starts with introducing yourself and being transparent and vulnerable with them. And a lot of times they'll reciprocate that. I think, I guess, putting a script together is a good pearl as well. Just kind of having an idea of how you want the conversation to go. But don't cling to it so tightly that you just sound like, a telemarketer or something like that. Right. Like, they want a relationship. Most people, I shouldn't say most people, but a very significant portion of the population has dental anxiety. They're not too hot on coming to the dentist, even though they know they need to be there. And so, when you can assure them that you're a good person with good intentions and you're very warm and inviting, that at the very least gets them in a chair, and that's super important. So that's a big one, just as far as like, calling the patients to begin with.
Right. Yeah. That's a great tip too. Like I felt like such a robot at first too, just because, it's so new, and like, you don't know how loud they are going to be on the phone, and like how many times you have to repeat yourself for all this. Like, these are all just things, like you said, like that just kind of run through your head. And, okay, go ahead. I know you got a story.
So you wanted a funny story. God, I hope I don't butcher this, because this was like one of my first patients, and he's not my patient anymore, but, I had called him and I introduced myself. I said my name and everything. And we had a pretty decent rapport going on. And I called him again to just confirm that he was going to be able to make it to our appointment. Cause I was super wary about no shows. And, he answered the phone, and I was like, hey, it's Tyler from the dental school and everything. And he was like, oh, hey, Robert. And I was like, I'm the one from the dental school. And he was like, yeah, Robert, how you doing? And I was like, I'm doing great. And from that moment on, my name was Robert. And he called me Robert in the chair at the clinic. And I couldn't correct him anymore because he was just really set on calling me Robert. And from that point on, I was answering to Robert. And I think at one point he had gotten lost. Like he couldn't find the clinic. Right. And they had asked him who his doctor was. And he, of course, says Robert, and there's like no Robert in my class. And so that was like a huge fiasco. So they were like on the intercom, like calling for a Robert, just like a Robert to come over there and talk to him. So yeah, that happened. And after a while I would call, and like, if someone else answered the phone, I was like, yeah, tell such and such that Robert called, he's calling from the dental school.
Oh my gosh.
So yeah, I kind of had to assume a different identity, and I was answering to Robert, like outside the school, like from different people. If I heard Robert in public, hey.
Dude, that's hilarious. Yeah, that's going to be the title of the episode. You're not going to be Tyler Tolbert in this one. You're going to be Robert Tolbert.
Yeah. Bob.
Yeah,
Bob Tolbert. Yeah.
That's good. Yeah. So another thing, I really want to know, like, just knowing yourself and knowing your classmates and dealing with patients, like, what sets apart, like, students that are just really good with patients? Like, what are the extra steps that they take with patients, or, the little things that they can do just to really put patients at ease and make, make sure that their experience is as good as it can be?
Big ones, confidence, congeniality, charisma. Just like, don't, even if you have to pretend, and actually you will have to pretend that you know what you're doing, just, it's okay to pretend, like project that on the outside, because your patients, what they really, really want is to forget that you're a student.
Yep.
That's
a great way to put it.
Yeah. I mean, obviously you don't want them to have unrealistic expectations of you. You do not want them to be judging their experience off of like standards in private practice where they think like they're going to get 5 fillings in one appointment, or, come to the school twice for a crown. You don't want that to happen, but like they don't want to think of you as a dentist in training. They want to see you as a doctor that knows what they're doing. And do you have to be the very best dental student in your class to do that? Absolutely not. I am by no means that person, but I do know that for the majority of my patients, they see me as a doctor. They refer to me as a doctor. They like really defer to my professional opinion. I remember my very first appointment. I had found that my patient had just a complete vertical crack down her tooth. It was a split tooth, actually. It was like probably all the way down the root. And I identified that, and we were kind of giving her some options of what she could do. And my attending was kind of walking her through it, and he gives her a bunch of options, and she's just kind of nodding her head. And then he walks off. And now this is obviously, my attending's a dentist, right?
Right.
Has been there for a few years. He walks off, and then she looks at me and she was like, well, I want to know, in your professional opinion, what would you do?
Right.
And it's like,
you weren't prepared for that.
I was like, I'm a student, and I don't know if you know this or not, but you were my first patient and you're asking me for, my professional opinion. And I think where that really came from was just the relationship that I had formed over the phone, my personality, and just my confidence, like just being like, I knew exactly what was going on, and we were, moving through the motions and stuff. And I think just being able to project that and getting that sort of feedback, it helped me too, to kind of make me feel like I knew what I was doing. That was really big. And it's like, people tell you fake it till you make it, but it's imperative that you do that for your patients, because there were times in clinic where on the inside, I'm just like blowing up because I'm like, none of this is going right. Don't think I'm going to get this done in time. I'm going to look like a fool. And on the inside, you're just broiling. But if you communicate that to the outside and they're able to perceive that and take that in, they start feeling that way too. And they start getting worried and they're nervous. And, to them, they actually have more skin in the game because you're doing something in their mouth. Like you're cutting their teeth and you've got all these sharp instruments everywhere and you're poking them with needles and stuff. Like you don't want them feeling your apprehension. That is super, super contagious. And they're super, super perceptive and hyper aware of those kinds of things when they're in the chair. Again, dental anxiety, very common. You have to sort of set the tone for them with your own composure. That's just a huge, huge thing.
Right. Yeah. That's great advice right there too. Like, and another thing I've noticed, and obviously I don't have the experience that you do, but some things that I've noticed from like shadowing other students or assisting other students is like, what really helps patients is, especially when you're going through like treatment options, is if you really take that time to talk to them about things. Like I've been in situations where just the very basics of the treatment plan were explained, like, oh, this is a crown. Like it goes like this and sits on a tooth, whatever. And, sometimes I can see that the patient still doesn't have a full like understanding, and then I've seen other situations where they have models ready to go and they have pictures drawn. And it's like, I feel like when you're able to explain exactly what you're going to do, and not in dental terms, I feel like we've all we've all been there at times, like, using all of these, this dental terminology to try to explain things to patients. And you can tell it goes right over their head. Like the ability to be able to make patients understand dental treatments, in layman's terms, air quotes, I really think that makes them understand. And I think when they understand, they perceive you as being more confident, and I think they feel more comfortable as well. Like, I don't know, that's something I'm really thinking about. I've been looking on Amazon with all these different dental models and stuff. I can get ones with implants and crowns and bridges, just so like I have those in my arsenal in case a patient asks me, and I can say, hey, this is what this looks like, and they can see it and they can feel it, and they have a good understanding. I don't know.
Yeah. No. You are right on with that. I love the models. I love the pictures. Personally, I didn't do that, not because I didn't believe in it, but because I was just kind of lazy and would rather just kind of, rely on my communication skills, but like, I think that's great. Like I've seen people with the models and like case acceptance is wonderful. Like they understand why it matters. But gosh, avoiding the dental terminology, like that's something you have to practice like outside the chair. Like honestly, challenge yourself to, if you're reading something about like a complex dental procedure, work through the whole, like explain like I'm 5, like figure out how to explain that to a person without saying a single word that is germane to dentistry.
Yeah.
Find analogies. There's actually books on dental analogies. There's a book called Dental Analogies. It's by Dr. Rick Waters, available on Amazon. Yep, very good one. I know him personally, actually. That's how I know about the book, but it's a very good book. It's got some really good analogies in there. And there's just a lot of words like you just don't want to say. Like they're obviously kind of scary, like cutting teeth, drilling. I never say the word drill, ever. I don't say the word drill. I don't say blood. I say heme. I don't really say needle ever. Mm-hmm. I don't even refer to the needle. They never see it. I don't, in the way you talk about teeth, you have to be really careful about that. Paul Goodman actually posted something on his Instagram the other day that like really cracked me up. He was like, dentists, like we say such weird things sometimes that are just in no way normal to say. Like, have you ever referred to a tooth as a virgin tooth to a patient? Like why would you ever say that to another human being that's not a dentist,
Right.
Because that literally infers like, okay, this is a virgin tooth and what I'm about to do to it is going to make it not a virgin. Like that's not a good connotation that you want to give your patient. So like definitely being cognizant of that and training yourself to not talk like a dentist and only do that with other dental people.
Right.
Like when you're talking to your family or whatever, don't use jargon. Like really like just, it's like a quarter in the swear jar. Like don't talk about taper or retention or whatever. Like, you can explain these things in simple terms. And what that often really illustrates is that you actually have a comprehensive understanding of the concept if you're able to explain it in a simple way. That's really required for really having that sort of integrative understanding. So you are right on the money with that.
Yeah.
Don't talk like a dentist. Explain it like you would have when you first got into school and didn't know anything.
Right.
Which you knew a lot of stuff by then because like you were like doing all kinds of stuff before school, but explain it like you're not Brandon Everett and you'll do fine.
Not even close. You know what? Here's the thing too. And I think about this all the time is, when I was back with Dr. Moody in South Dakota doing my internship, working in his lab, and I didn't they were talking about margins and they were talking about, all of these things. And I had no idea. And I really wish I could, and I'll probably make my way back there soon, but like knowing what I know now, I wish I knew what I know now when I did that, because it would be a whole new set of eyes. It would.
And that is like a totally, that's one really beautiful thing that happens with clinic too, is you'll go back and you'll look at lectures where, you were like, I remember when I was in dentures class and you just got done with that.
Mm-hmm.
When we were walking through like the bite records appointment or like the jaw relation records and stuff.
Right.
And I was like, I have no idea what any of this is. Like none of it makes sense. It's just pictures on a PowerPoint. Like I'm not getting it at all. And you're able to kind of just go on autopilot. You're like, whatever, like we have so many slides to go and we'll just get to the end of it.
Yeah.
And I'll pick out what's probably a question that could be asked. When you're actually having to do it in clinic and you understand what the purpose behind these things are, like you were just able to think so much more critically about all of these processes and like really understand what their purpose is. And it just, I don't know, things just come full circle. And I sometimes wonder if it would actually make more sense to try and do it first and then learn why you did it afterward.
That's interesting.
But that's not really how school works. Like I'm going to reference Paul Goodman again. I went to his My First Implant course in Philly. And on day one, we did not do a lecture. We did not see a PowerPoint. We went in. They had all these implant models set up and they had the implant motors and everything ready to go.
Right.
They said, all right, place an implant. And it was like on these data forms. And we were like, you haven't told us anything yet. And he was like, yeah, that comes later. And we did it. Like we just placed the implants in these little blocks of wood and on the dentiforms and stuff. And when you do that and you learn about it later, you have this sort of like kinesthetic visual
like
memory
reference point. Yeah,
exactly. And it's like this whole file folder. And as you are interpreting more didactic information, you're able to kind of sort it back into that folder in a much more easy to understand and memorable way. And as you're going through clinic, you'll notice anytime you take on like new information about a procedure, like you'll have more questions that are more practically minded that'll come up when you're actually doing it. And every time like I learn a new dental concept, I imagine what it would look like in the chair.
Right.
I'm thinking about how would I approach this if this were actually my patient and I, needed to have an answer for this problem or needed to be able to at least identify this problem. That's one really amazing thing about clinic is it just changes the way you learn dentistry.
Right. Yeah. And I think this is the point that everybody's been waiting for. Now we actually get to pull everything that we've learned, which is, it feels like very limited knowledge at this point, like, because I mean, you're armed with the knowledge, but then you have to know how to do it and you have to know all the steps. And then you also have to know how to modify things on the fly. Like everything is not, I was in a case today, very difficult denture case. CR wasn't matching the patient's like, I forget what it was, but it was just like the denture was not occluding properly and the CR record was off, and you have to know how to fix those things on the fly. Like every case is not going to be ideal. So that's another skill that I look forward to, or not look forward to, because it's going to be frustrating, but working on.
Right. Cause like on a mannequin, everything is perfect.
Oh, I know.
I mean, like when I do a crown on a mannequin, which is what I do all day long now, like I prep it and I take an impression and it's a perfect impression every time.
Right.
I mean, it's flawless. There's no bubbles anywhere.
No gag reflex, no nothing.
No blood, no saliva, no nothing. And, and it's like, if you can't do it on the mannequin, good luck on a patient, so just be prepared for everything that you've done on a mannequin to be like 10 times harder all of a sudden for some reason.
Right.
It's also like you kind of have to get used to actually cutting on people's, there I go, using the word cutting. But like working on people's teeth, like that's their actual teeth. And like, you're like really apprehensive about that at first. But you get used to it and it's really empowering when you do, like when you're able to, when your patient leaves your chair better off than they were when they came there and you realize that you were the difference. It's an amazing thing.
Yeah. I can't wait to experience that and feel that.
I know. I mean, you'll be doing it before me, it sounds like. So,
well, maybe we'll see.
You'll be doing it probably next week or something like that. So that's good.
Yeah, I'll be dropping about. I'll do an all-on-4 next week, I think, and we'll just.
It's not like you don't know how. It's just it's the opportunity.
Oh, that's right. That's right. So, I guess, we can slowly start wrapping up here. I don't want to take too much of your time tonight, but like looking back on, you're a D4 now, right?
I am.
Okay. Well, I guess
sort of
quasi D4 because you're just sitting on on Dexter all day, just, working on him. But
yeah, you're right.
But no.
You're absolutely right.
But looking back on your D3 year, knowing what you know as a D4, like what are some nuggets or pearls of wisdom that you have, or like your big top 2 or 3, regardless of patient care or whatever, it doesn't matter.
Under promise, over deliver, or just deliver. That's fine.
Right.
But always under promise. I felt very early on when I was talking to my patients that I needed to sell them on coming to the school, accepting treatment, telling them that it's, we're going to get it done. Like I can probably do this in like 2 or 3 appointments, and no, it'll be painless, and it's going to look great. It's all going to be perfect. And, I'm sending off the impression now, and we'll get the crown back in a couple of weeks. And I got burned every single time. And, when you tell your patients what to expect about something, the first time you tell them, they're like, okay, and if like, let's say I tell them you're going to get the crown back, and I'm being like really optimistic. I'm like, yeah, we could get it in 5 business days. We might have it next week. They're like, okay. Right. Like they're good with that. They'll take that. And then, the crown comes back in 2 weeks, which is actually a pretty reasonable time. And then they're like, well, you told me it'd be a week. This was twice as much as you told me.
Right.
Yep. And now you've let them down. You've disappointed them. You let them have these higher expectations despite, consequences you knew existed, but you didn't want to tell them that for some reason. But if I had just come out and said, yeah, honestly, sometimes these crowns, I mean, they come back and they're great, but they can take about a month, and then it comes back in 2 weeks, and they're like, wow, like it came back in 2 weeks. That's amazing. You know, set the bar, like set yourself up for success. I mean, it's the easiest thing to do, just by being a lot more realistic and then taking it one step further to like have a somewhat pessimistic, expectation. Like when I would get a final impression for a crown, I'd tell them, hey, look, this impression looks good to me as it is, but sometimes I got to be honest, we'll go back to the lab, we'll pour it up, we'll take a good look at it, and we'll say, you know what, this really isn't quite to the standard that we want to hold ourselves to, and we're going to have you come back in and do another impression. Sometimes we have to do that 2 or 3 times.
Yep.
Now, do I ever go into it thinking I'm going to have a patient come in for 2 or 3 final impression appointments? God, no. I think I don't know if I'd be able to finish school if that were the case. I mean, I've had to do it, but good Lord. But when they have that expectation straight up, and you're not trying to tell them like, oh yeah, this is the first and last impression, here we go. You're setting yourself up for success, and you're not having to be any better for it. You're just having to, all you have to do is just be a little bit more honest and set the right bar.
Right.
And that permeates into everything you talk to your patients about. Like, you don't have to like completely undersell what we do, but just be aware of how things are going to go wrong, and try and get ahead of it and not learn it firsthand the way I did, and just set realistic expectations. The next one I would say is, you talked about case presentation a little bit earlier, whenever you're presenting treatment. This is just sort of like a general case acceptance principle, but never assume your patient's financial means.
Of course. Yep.
Just because they're coming to the school that doesn't really say much about how much they might value what you can do for them through dentistry. It doesn't say much about what they're willing to invest at this point in their life, and they deserve to be presenting the ideal treatment, whatever that may be. And when you give it, and when you say, this is what we can do, and they'll ask what it costs, and you give them the price, you just wait. You don't say anything. You just say, yeah, this is what I would do with my own mouth. This is what I would do for my mother. And it costs X amount, and you just wait. And they may not say anything for a minute, and you may judge that as them being dumbfounded by the price, but in reality, they might just be thinking about it. And if they say, I don't really know if I could pay that right now, then maybe your school has some financing options, and you talk about how you can make it more manageable. If that can't work, then it's like, okay, now we make some compromises and we go to the next thing.
Right.
And then you just kind of, and you repeat steps 2 through 4. Again and again, like you try and make something work. That is not just beneficial for doing more dentistry. It's your job. I mean, why would you prejudge your patients and give them something less than ideal? I mean, that's not what we're here to do. So there's nothing salesy about that. Like it's just good practice. And I think that we always just have this urge to, like, when there's that awkward silence, to just start like being like, oh, but we could do this as well, and it's way cheaper, like we want to save it because we're uncomfortable, and just let go of that. Like, just understand that, like, it's your job to pitch that like ideal treatment, and try and make it work for them. So I actually it's really funny, you texted me about this right after someone else had they were putting like a Google Doc together for tips, so I'm just kind of looking to get through this. Yeah, it was actually really brilliant. That may actually be a good tip too. If you're just starting clinic, try and put a Google Doc together and ask seniors like what they would want to know, because there's a lot of stuff I put in here that's like really germane to my school. Like, I know it's probably not applicable to yours,
right? But
like, get stuff from people at your school. They will be able to tell you about faculty. That's a big thing. Like, who's attending you when you're in clinic makes a world of difference. And I mean, maybe that's just with the way that my clinic's set up, but like, that can be the difference between me doing like 1 filling and me doing 4 fillings, or prepping the crown and impressing it, or reappointing the patient. Like that, I mean, knowing how the faculty works, how they gel, what their pace of things is, and what you should be doing with who, that's big. And, that's kind of specific to, wherever you are. Yeah. So I think that really probably sums it up pretty good. I think, here's one more.
Okay.
So assuming that you're in charge of scheduling your patients, always pre-book your patients while they're in the chair. So after the appointment's over, you say, all right, let's figure out the next time I'm going to see you. You turn around, you go into your Axiom or whatever, you find an opening, you book it, and then they leave. Because if they leave without an appointment, then there's this opportunity for all these other things to come into their life that they have to schedule. You have to get a hold of them again. You have to figure out that date. You have to present that to them. They're probably going to have to get back with you. Like, there's all this communication, all these calls that have to happen. There's all these other things that they could be scheduling it for. If you lock it in while they're in the chair right there, boom, like your no-show rate and cancellations just drops right out of the air. And that goes through into practice in the future. Like, that's one of the most important performance indicators for dental practices is the ability to reappoint patients, like before they leave. Like, that's actually a really, really big principle. So go ahead and start enacting a lot of those things.
Okay.
And finally, it's not exactly a tip for like how you can do better in clinic, but maybe just like a tip for like the career in general is, when you're working on this patient, imagine you're in that private practice environment, and that doesn't mean you have to go like try and do everything at light speed and be really careless. But just remember, at some point you're going to graduate and you're not going to be in a student clinic anymore, and you're not going to have 4 hours to do these things. There's not going to be someone there to save you. A lot of times you'll get the impulse to say, hey, I need help. Like, I need somebody to bail me out of this. I can't seat this matrix band or whatever. Give yourself a moment to try and problem solve. That's one of the most important things that we do in dentistry is problem solving. Just like you were saying earlier, like, little things happen and you have to be able to improvise and make things work on the fly, and you have to give yourself the opportunity to do that, and you'll grow a lot from it by doing that. So I think that's probably the good bulk of what I got of my 1 year of dentisting experience.
Dentisting.
Yeah.
Man,
see,
Go ahead.
I know this is like the third time I've like mentioned Paul. You know why I think he's like so in my mind right now is because he says dentisting all the time. He was on with Gary Vaynerchuk, the motivational speaker guy. He was on his show.
No way.
And I think that's just like so in the forefront of my mind, because I just woke up one morning and like my Facebook notifications popped up. And he was like, Paul Goodman on with Gary V. And I'm like,
no way.
This has got to be a joke. That's not Gary V. And sure enough, he was talking to him about dental nachos. Kind of blew my mind. But
that's wild.
I digress.
Well, man, you should seriously write a book about all of those tips you just shared. I already have a title for you. Ready? It's called Pearls of Wisdom by Robert Tolbert.
I hate it. I hate it. Speaking of writing a book, have you written a book?
I did. Yes. Back in the day. It's okay. So it's a good guide, especially it's geared toward pre-dental students about getting into dental school. So I put like a copy of my own personal statement in there and like what admissions board look for. I put my DAT study guide and study schedule. Like basically it's a compilation of my own personal notes that I made, like going through the process, because like your pre-dental advisor and undergrad, like, they know a lot and they can point you in the right direction, but there's so many like nuances that they don't necessarily know about or talk to you about. And that's pretty much the foundation of the book. And that's basically the foundation of this podcast, really. Is just to help others who are, anywhere in their dental career, just like get them from point A to point B a little bit easier, share some inside tips and, that's what it is. Yeah.
I was so mad isn't the word, but it's what I'll use. I think I was talking to Peyton about you, and he mentioned that you had written a book. Cause I was bragging on you like I do all the time about you, like having started your own podcast. Oh, stop it. And about all the things you do. And he was like, yeah, didn't he write a book? And I was like, he wrote a book? Like, what do you mean he wrote a book? And he was like, yeah, it's like on Amazon and stuff. Yeah. You just never cease to amaze me. And writing a book is almost just like, it's almost like you did it just to say it. And I know that's not true, but man, you're just so far ahead in life, and you're so dedicated to helping people out, getting from point A to point B, like you said. And that is just so inspiring. I would just never have thought to write a book about anything. I that's just awesome.
It really wasn't like me sitting down and be like, you know what, today I'm going to write a book. That really never crossed my mind, but I was just looking through, as I was applying for dental school, just looking at my computer, and I had all these notes of like study guides and copy of this and, study schedules of that, or like interview tips that I've picked up from podcasts or, wherever. And I was like, why don't I just throw this all together into a guide for other students. So that's really all it was.
Yeah, I'm looking at it on Amazon right now.
That's my own pano, by the way, on the cover. It is.
Oh my God, Brandon, this is ridiculous, dude.
You can see my number 32. The roots are touching.
I see that. Wow. Yeah, I'm gonna have to go through your pan, test my diagnostic abilities.
Oh, it's flawless. You're not gonna see anything.
Man, you got a mouthful of teeth.
I do. I have had those removed, but.
Oh, really? I'm jealous. I think I've got like 24 teeth. I don't know. I've had a lot of them removed since I started school.
Since you started school, for what?
Yeah, I mean, I hadn't seen a dentist in like a long time, and we just found all kinds of stuff going on. I was like, oh, okay. I guess. I mean, I have to practice what I preach. I can't be walking around with like a mouthful of like dental decay and impacted teeth and stuff. So it's been good. Like every time I'm seen at the school, I have a mirror and I just watch what they're doing the whole time.
Really? That's awesome.
They told me that's pretty hardcore, but I guess I am.
That's awesome. I was hoping you were going to say that you booked yourself a chair and you just started pulling your own teeth out.
Dude, I'm not there yet, but I did see.
Did you see that video?
Which one are you referring to? The guy that pulls his own tooth,
yeah,
right?
The Russian dentist?
The Russian guy.
Yeah.
There's another one in America, might I add, and I think there's like a space race going on that did his own immediate.
Really?
His own immediate implant. He like did it in the mirror.
That's awesome. I think I might have seen that one too, but that's awesome.
I'm not sure if he used a guide. I think he actually like hand placed his own
freehand,
implant.
no big deal.
Yeah, which is probably one of the most badass things.
I was just gonna say that is a baller move.
yeah. I'm sure he got some new patients from that too.
Yeah, absolutely.
And a new tooth. So, yeah, pretty big deal there.
Oh, yeah. Well, that's awesome. Yeah. All right, man. Well, I think that's all I got.
Yeah, no, I think that about wraps it up. I mean, it's hard to really, there's so many things that you go through in clinic that you have to just learn by doing.
Mm-hmm. Absolutely.
And it's hard to just kind of like give tips that are going to make it happen. I mean, really, it's so much just a mental mindset thing of just being able to go in there, be prepared.
Just do it. That's the key.
Yeah, just do it. I think that's probably the most golden pearl there is just do it.
Right.
Don't be too apprehensive. Don't be afraid of getting into some, tough spots. I mean, that's where you learn the most. I mean, just in general, if you're uncomfortable, you're growing. And if you're comfortable, then, you're just kind of being stagnant. So, getting into clinic is something that every dental student is just like biting their nails for. And, in some ways it's going to be everything you hoped. In other ways, it's going to be a lot that you didn't expect, but just embrace it the best you can and understand that this is what you signed up for, and it's time to make the most of it. So,
couldn't have said it better myself.
I'm sure you could have. You could have written a book on
it. No way, dude. All right, ladies and gentlemen, thanks so much for listening to this podcast. Tyler, as always, thanks for being on the show tonight. And
hey, it's a pleasure, man. Every time you send me a text, I'm just hoping you want me on the show.
Of course, I always want you on the show. Always. Whenever you want to be on it, we have something to talk about for sure.
All right, same time next week.
All right, sounds good. We'll be there. All right, Tyler, take care. Thank you so much.
All right, buddy. See ya.